The age group primarily abusing here would be older teens and young adults, meaning like 20s to early 30s.
But we're seeing everybody. Doesn't matter what gender or economic standings.
We encounter everyone from 16-year-olds to 80-year-olds that are not only actively involved in abusing, but actively involved in felony trafficking activity, either for profit or to support their own habits. We dole out a lot of prescriptions in Maine, which means that there is a surplus of these powerful narcotic painkillers in medicine cabinets and in people's pockets. Clearly, many of those are unneeded and unused and are sold on the street instead of being used properly.
We're only 12 miles from Canada. Going to a Canadian pharmacy and picking up hydrocodones at higher milligrams than we have here is not uncommon.
Smuggling through the mail and through parcel services from other states where perhaps their rules are more lax than Maine's is a big issue.
So we have that importing of prescription drugs from all around. 80% of my crimes has some type of prescription drug involvement. So we felt that if we could get the prescriptions out of the homes, they would be less likely to have some type of invasion. And that's worked.
We've also started what's called the Diversion Alert program, where every month we send physicians a mailer about who's been arrested for prescription drug abuse or diversion in the county.
It goes to all the clinics and all the 4 major hospitals and all the pharmacists.
We've had 52% of physicians say that Diversion Alert helped them to identify a patient who was diverting or abusing. It's helped them communicate more with other healthcare providers about shared patients, that they became more aware of prescription abuse as a result of the program.
The ASAP Coalition has really been instrumental in helping us gather that education and the tools that we need to make really good decisions with those folks that are in chronic pain or just a pain injury. Now we feel more responsible to make sure that we're doing healthy behavior for our patients and not putting them at risk for addiction.
Since Diversion Alert has been out there, that the medical community has felt much more comfortable having conversations with law enforcement and vice versa. Appropriate information is being passed back and forth so that rather than being part of the problem, the medical community can be actually part of the solution.
When you look at that and you identify a patient that's yours or a patient that you think might be in our practice, that's where we really can get on top of what's happening. We usually call the patients in. We'll look at right then a drug screen, a pill count. If any of those things are off, then they know they can be discharged from our practice.
I wasn't entirely sure when we went into this effort that it would last. I wasn't entirely sure that it would be successful. It is lasting, it is successful, and these community coalitions are really the only long-term answer to trying to address the problem.